Thank you for joining us for Who Gives to Healthcare Organizations. I'm Betsy Chapin Taylor of Accordant Philanthropy. Many healthcare organizations ask governing board trustees and foundation board members to help connect those in the community to the cause. However, often these community leadership volunteers aren't quite sure who to talk to. Today, we're going to explore some of those issues to help you really leverage your influence in advancing philanthropy. It's first helpful to consider why people give to charitable organizations in general. There are a lot of different reasons that motivate philanthropy. Some people come because of a value alignment and a passion for the mission. They believe in the work. Others have had a personal experience or a loved one impacted by the work. Some want to give back. They've been blessed in their own lives, and so they want to do something for others. Some see giving as a civic or moral responsibility, or they've come from a family tradition of continued philanthropy. Some want to be part of something with like minded people or find social prestige in being attached to a great organization. Others are looking for a way to get involved or to find leadership opportunities. And some are simply influenced by seeing where those they look up to are connected and engaged. And when that person asks them, it's an inspiration to get involved there as well. In the healthcare organization, it can be helpful to consider how to uncover those who care. First, it's about connections. Do you have an authentic and real connection? Someone who has influence, who is a respected right ally. Often, people will look at someone in their community and say, well, that person has money to invest, or they're philanthropic in other places. However, if you don't have a trusting and authentic relationship with that person, it's often very hard to forge a real partnership. Second, it's important to look for alignment. Is this their purpose? Is this their cause? Do they care about healthcare or do they care about the arts? If they do care about healthcare, do they care about oncology, cardiology, pediatrics, or something else? Even within a service line, do they care about technology, about programs, about research? Where are their values? What is their passion? What would they be motivated to get involved in? Finding that alignment is critically important to, again, finding a great fit with a prospective donor partner. You also have to consider resources. Do they simply have the financial ability to participate? Often there are people who are motivated and moved by our work who simply don't have the ability to get involved in a significant level. And we need to be conscious of this as well. Finally, in the healthcare organization, we know that experience is critically important. Have they utilized our facility? Do they know us well? In the healthcare organization, we know that the vast majority of our largest gifts come from grateful patients and grateful family members. This makes a lot of sense because patients and family members have a keen sense of what we do. They've experienced our mission in action. They've seen the impact of our work. They know how meaningful it is to all of those who walk through our doors. It also makes sense from another perspective. Most people wouldn't give to a school that they had not attended, and they wouldn't give to a faith tradition that they didn't embrace. So, experience and deep understanding are a great point of alignment with those who could or would be partners to us. In the healthcare organization, we know that many patients and family members say that they gave out of gratitude. With that, it's important to understand that gratitude is distinct from other thankful emotions like appreciation, and it has some unique dimensions. For example, gratitude has a benefit that was freely given, that was intentional, worthwhile, and memorable. It was unexpected, unsolicited, and unearned, and it caused wonder, insight, humility, and sometimes awe in the receiver. So you have to think about the patient experience. Many patients come to the organization and feel that they've provided compensation in the form of insurance or payments, or sometimes something as distant as taxes that would provide them access to quality medical care. So often those things that are unexpected, unsolicited, and unearned are really about discretionary effort. It's where a caregiver provided comfort, compassion, human and humane treatment, attention to social and emotional needs. Those are often the dimensions that are really driving gratitude. It's also important to understand that the beneficiary intuits why someone did something for them. Researchers at Columbia University say that there are typically three reasons that would motivate someone to help another. First, it's about role driven obligation, that maybe the clinician or caregiver was doing it because it was their job. Secondarily, though, it could be because there was a cost benefit analysis, that they thought the caregiver thought they would get something back in return by being nice or generous or helpful or providing great care. Third, though, they say that it is because someone cared about them, that they were uniquely motivated out of compassion or out of wanting to take care of the person who was in front of them. When patients and family members intuit that the third reason, compassion and genuine care, is the reason that a benefit was provided, that's what triggers gratitude. Dr. Robert Emmons of the University of California, Davis is one of the world's foremost authorities on the science of gratitude. And he said gratitude, while a virtue, is also an action, that gratitude felt must be expressed. And so when patients feel gratitude, they want to express it by giving thanks or by demonstrating generosity. Philanthropy becomes a natural expression of thanks in the healthcare organization. Gratitude can also enhance the healing process. Practicing gratitude boosts emotional and physical well being. It has a range of positive effects. It lowers blood pressure, improves immune function, decreases pain, and facilitates more efficient sleep. Ultimately, gratitude not only feels good, it's good for you. It's also important to know that it is legally and ethically appropriate to engage with our patients. Many organizations will train their trustees and foundation board members about HIPAA. HIPAA privacy rules are intended to safeguard protected health information. Under HITECH, released in 2013, it was made very clear that fund development professionals who are charged with advancing philanthropy have appropriate access to a range of information, including name, gender, date of service, insurance type, physician name, area of service, and some basic outcome information. So it's appropriate for philanthropy to consider those who have a real relationship with the organization as they think about those who might wish to get involved. It's also helpful to know that physicians have outsized influence on this relationship. Patients often see their physician as being the architect of their care, the person who helped really facilitate them getting better. So many organizations engage physicians actively in spotting gratitude and referring those who are grateful to the healthcare organization. That means board members need to know that physicians can be great partners to us in advancing philanthropy. As a trustee or board member, considering those who might be motivated or moved to get involved in the healthcare organization, it's helpful to remember that people will come to this cause for a variety of reasons. There will be those who give because the healthcare organization is an important part of the social fabric of the community. There will be those who give out of a philanthropic tradition with their family. There will be those who give because they want to associate themselves with a great institution. However, those who give gifts that are the most vibrant and the most transformational are often those who have walked through our doors and down our halls. They are those whose lives have been touched, changed, and transformed by this organization. They are those who have found meaning, purpose, and values here. Thank you for exploring the topic of who gives to healthcare organizations. Thank you also for your service and for the valuable role that you play in advancing philanthropy to healthcare.